There's something they're not telling you about the new Cyclospora outbreak.
There is a parasite that is currently spreading all across the country right now in fresh fruit and salad, and it gives you explosive diarrhea for weeks.
Okay, can somebody who has the parasite right now tell me exactly what they ate that gave it to them and what it feels like? Because a month is insane.
We are in Colorado and contracted the viral Cyclospora, unfortunately, the day after Father's Day, and it lasted for 8 days.
Explosive diarrhea has reached almost 1,000 people in the US, and the main culprit is something called Cyclospora. Here's what you need to know.
A parasite that most Americans had probably never heard of a week ago is suddenly making headlines across the country. Health officials are investigating a growing Cyclospora outbreak that's been reported across dozens of states, and they're trying to determine exactly what's behind it. Cyclospora is a microscopic parasite that can infect the digestive system after people consume contaminated food or water. Unlike bacteria, it's a single-celled parasite, and infections can leave people sick for days or even weeks if they aren't treated. Investigators are looking closely at fresh produce. While no single food has been officially confirmed as the source, leafy greens, bagged salads, herbs like cilantro, basil, and some berries are among the foods receiving the most scrutiny because similar foods have been linked to past outbreaks. The most common symptoms include watery diarrhea, stomach cramps, nausea, bloating, fatigue, loss of appetite, and sometimes weight loss. Symptoms often don't begin until about a week after exposure, which makes outbreaks especially difficult to trace. So let's look at what people online are saying, what's actually been confirmed.
I've seen a lot of articles about this new explosive diarrhea parasite. NPR is saying what to know about it. USA Today is talking about how it's changing restaurant menus. New York Times is telling you how to stay safe from it. And NBC is talking about the amount of hospitalized cases. But there's one thing that every single one of these articles is not doing, and that's putting the outbreak in context. Because if you were putting the outbreak in context, you would have to say that last summer, a program of the CDC quietly stopped tracking 6 different pathogens, including Cyclospora. Monitoring was no longer required for the states involved in this program. Dr. J. Glenn Morris, the director of the Emerging Pathogens Institute of the University in Florida, said, quote, "Essentially, CDC is backing off of one of their best surveillance systems." This program that monitored the pathogens, called FoodNet, was the only surveillance system that looked at multiple foodborne illnesses at the federal level. And why did they stop tracking all these pathogens that has now led to this serious outbreak of an illness? Because of Trump's budget cuts. Oh, there it is. The actions have consequences, and maybe funding things like public health actually keeps Americans safe. If the Trump administration hadn't cut $600 million from the CDC's budget, we could actually track the things that make Americans sick. And I honestly think it's really irresponsible reporting for these news outlets to not scream from the rooftops that the reason we're having a Cyclospora outbreak is because the CDC is underfunded, and so they have to limit the pathogens that FoodNet was tracking because of Trump's budget cuts, because it always goes back to who has the money and what is that money being allocated for.
Monitoring cases in at least 18 states, and that includes hundreds of cases in the tri-state.
So this parasite is all over the internet right now. It's called Cyclospora, and you get it from fresh produce. They're saying that the parasite comes from pre-washed bagged salad, berries, and herbs. They're also saying that washing it off doesn't even work because cooking it is the only thing that gets rid of it, and nobody's wanting to cook their raspberries. Once you have it, it can give you explosive diarrhea for weeks, and some people are stuck with it for over a month. It doesn't go away on its own either because you need a specific antibiotic to actually clear it, and you're dealing with cramps, exhaustion, and dropping weight the entire time. It's currently spreading fast because it's already in 18 different states and it's still climbing.
This is an important update regarding the explosive diarrhea cases that has been caused by the parasite Cyclospora that has sickened over 3,000 people. My name is Dr. Rubin. Today is July 14th, 2026, and there is a headline that is catching people's attention from the Washington Post, which states that health officials are investigating Taco Bell regarding this current outbreak. Here's what you need to know about it. Taco Bell recently removed several items from its menu out of an abundance of caution, including onion, cilantro, and lettuce. And over 1,000 people from Michigan who were affected by this outbreak were interviewed. Many of them had stated that they had eaten at a Taco Bell recently, but many had not. So we can't assume that Taco Bell is at fault here, but health officials are trying to investigate the source of this outbreak and how it was distributed, which Possibly many Taco Bells could have been affected, but grocery stores and other places could be as well. So we don't fully understand what's going on. The leading suspicion is that it's from lettuce and salad greens, according to state officials at Michigan's Department of Health and Human Services, but we still are left trying to figure out what exactly is going on. When I hear more information in the future, I will let you know, so hit that follow button to stay informed.
Explosive diarrhea has reached almost 1,000 people in the US, and the main culprit is something called Cyclospora. Here's what you need to know. Cyclospora is a protozoan parasite that, when consumed, can cause nausea, diarrhea, fever, and cramps. This Cyclospora outbreak is a prime example of why we need to invest in food safety, because last year, during a large amount of the funding cuts, FoodNet was affected by it, which was the only federally active surveillance system that was tracking these pathogens. Last year, it tracked, I believe, 8 or 9 different types of biological hazards, and unfortunately Cyclospora was cut out of the program, so we don't really have centralized surveillance around this, which explains why we don't have a lot of information on what food caused this. A lot of people are asking me, what foods should I avoid right now? And we don't really know the exact food yet. We don't have a ton of information on this outbreak. Here's what you need to know, and also your state health department should be helping out with this, so if you work for the state health department, thank you, and y'all are doing the Lord's work. Although this outbreak has reached almost 1,000 people, there are no deaths associated with this yet. And the good news is that Cyclospora can be treated with antibiotics. Cyclospora is commonly associated with drinking water, the water used to mix with pesticides to spray onto produce, and previous foods that were involved in Cyclospora outbreaks were things like raspberries, basil, leafy greens, parsley, and snow peas. Cyclospora can also be spread through poor hygiene practices, so people who don't wash their hands and then prepare food afterwards, or in unclean food production facilities, food factories that aren't clean. Another thing that makes this outbreak so tricky is that the Cyclospora parasite, humans are the only hosts for them, and the testing methodology for this parasite is somewhat limited. I've already made a long-form YouTube video about how to properly wash fruits and vegetables, but I would advise, if you really want to be extra safe, to consider cooking all of your produce. Yes, this means both fruits and vegetables, because exposing this parasite to most food preparation temperatures, aka higher temperatures, is enough to mitigate it much more than just washing. And please be safe out there, wash your hands, and practice food safe practices in the kitchen.
A lot of people online are bringing up the cuts and changes happening across the US food safety agencies, and the reason this conversation matters is because outbreaks don't start when the public hears about them. A foodborne illness investigation begins months, sometimes years, before a headline even appears. It requires labs testing samples, scientists tracking patterns, inspectors investigating facilities, and agencies communicating quickly when something goes wrong. The entire purpose of food safety programs is prevention, catching problems before thousands of people become sick. When systems lose funding, staffing, or resources, the concern is that the system becomes slower. Delayed investigation means it can take longer to identify the source, longer to issue warnings, and longer to remove contaminated products from circulation. Now let's see what those who have caught the bacteria are saying about their symptoms and life with cyclosporiasis.
Okay, can somebody who has the parasite right now tell me exactly what they ate that gave it to them and what it feels like? Because a month is insane. I had norovirus a couple of years ago, and I do not wish that on anyone. I know people are joking around being like, ooh, skinny. I don't think people understand that a month is insane. This is not a joke. I'm actually scared to eat anything, and it literally kept me up at night. So can somebody please give me some insight on this?
All right, so on my For You page is basically people talking about that new parasite causing the outbreak in the United States, Cyclospora. And as someone that has been battling it for 3 weeks, I wanted to come in here and give my 2 cents. People they're taking this as a joke. Yes, we don't know where this came from and like why it's suddenly a big outbreak when it's something that has existed like forever. However, it is that bad. My symptoms started literally out of the blue in the middle of a workday. I started having severe nausea, vomiting, and explosive diarrhea at the same time, all controllable, so you can imagine that. And then I had fatigue, I had chills, I had sweats, I had a low-grade fever, and I had severe abdominal pain. This abdominal pain, I don't even know how to explain it, because I've had IBS for years. I've always had like GI issues, so I'm kind of used to having stomach pain and stuff. but this pain was like nothing I've ever experienced. It was literally a mix of the worst possible period cramps you could ever imagine, and then mix that with like food poisoning pains, and like, I don't even know how to explain it. It was horrible. Like, it was literally incapacitating. I've been in treatment for 4 to 5 days, I believe now, and I'm still not 100% well. I still have some of my symptoms. So for the people saying, oh, I want to get the parasite, I want to lose weight. No, you don't. You don't. Trust me, you're going to go insane by day 4 of like not being able to even eat bone broth. Because you're literally going to just like, you won't have appetite. And even bone broth is going to cause you such severe pain that you're just not going to want to eat anything. It has been horrible. Today is my first day at work after 3 weeks. Like, this isn't just a typical stomach flu. Like, oh, I'll be sick for 3 days. I'll lose weight. I'll go back to my normal life. Nope. It has taken me 3 weeks. So stay safe. If I were like to tell people anything, it's try to avoid the things that are contaminated if you still want to eat them, which totally, like, I get it. I'm going crazy not having salads or like eating strawberries, which is my favorite fruit, but try not to eat them or cook them down. Like, honestly, usually I don't take these things like that seriously, but after having like all these symptoms, I'm terrified. So I would really suggest people like be careful with this.
Guys, so I had it for almost 2 weeks. Pretty sure that's what it was because there's nothing else that it could have been. I had the exact symptoms. Explosive diarrhea. It's just regular. Any diarrhea is explosive, you guys. I love how they're like branding it as explosive. Diarrhea is explosive, okay? I would get nauseous here and there. I had such like low appetite, and I'm a girl that loves to eat. And I did have stomach cramping, not every day, but I would get it. So, you know what? This is what I have to say. Yeah, it sucks. It sucks to have it, but it's not as scary as everybody's painting it out like, oh, I'm not going to eat fruits. I'm not going to eat veggies, whatever. Like, you will get through it. I just took anti-diarrheal. I mean, yeah, it's a little harder to move on through life with it, but it's fine. You will be fine. You'll survive. There are worse things in life, so much worse things than this. I went through it. I'm fine. I survived. Yeah, it does suck, but if you take anti-diarrheal and you stay hydrated, you'll be fine.
We are in Colorado and contracted the viral Cyclospora, unfortunately, the day after Father's Day, and it lasted for 8 days. My guess is we contracted this through the organic raspberries that we got. Even though we wash all of our fruit in a vinegar bath, I think that's probably where we got it from. My recommendation to anyone in Colorado or any other state that gets the Cyclospora is to hydrate as much as you possibly can. Whether you feel like it or not, if you have to get an IV, get an IV. Cannot stress enough how important it is to hydrate. That means Pedialyte, that means Gatorade Zero, that means any form of electrolytes, salt in your water. If you can hydrate, try to do it. My understanding is that heat, from a video I saw from a doctor on here, is that heat is the only thing that kills it. Obviously, we're not microwaving or heating up our raspberries, so just be aware of that.
So I do have a major update on the U.S. Cyclospora outbreak. Michigan health officials are now saying that both lettuce and salad greens might be a potential source, but there is no product, grower, or supplier that has been identified, and other foods have not been ruled out. Michigan has reported more than 2,600 outbreak-associated cases and dozens of hospitalizations. Cyclospora is a microscopic parasite that is spread through contaminated food or water that can cause frequent watery diarrhea, abdominal cramps, bloating, nausea, fatigue, and even weight loss. Symptoms can begin 2 days to 2 weeks after exposure and may last or return for weeks. While the investigation continues, health officials do recommend choosing whole heads of lettuce over pre-washed bag greens, removing the outer leaves, washing the inner leaves under running water, and cooking greens when practical. Washing may reduce your risk, but it may not completely remove the parasite. Cyclospora can also be difficult to diagnose because routine stool panels may not include it. If you develop persistent watery diarrhea, make sure you ask your healthcare provider specifically about Cyclospora testing. The key update is that lettuce and salad greens are now a lead, but not a confirmed source. Make sure you share this video to increase awareness and follow up for more updates.
Should you be freaking out about Cyclospora? I'm Dr. Aisha Abba, infectious disease doctor. And my answer is no. But if you have diarrhea, I want you to listen to me because I'm going to tell you some things about treatment that I have not heard circulating on the interwebs yet. Cyclospora is a tiny parasite that causes an intestinal infection. It's usually linked to contaminated food or water. There are a number of outbreaks across different states, and in Michigan particularly, where there is the largest, public health is recommending extra caution around leafy greens, cilantro, basil, green onions, raspberries, snow peas. There has not been identified one specific food, brand, grower, or supplier yet. A reminder of why our public health system should not be, in shambles. Here's what I want you to know clinically. Cyclosporiasis is not usually life-threatening. People are going to be okay. It can be symptoms are watery diarrhea, frequent cramping, bloating, nausea, fatigue, sometimes a low-grade fever. Symptoms often start a week after exposure, unlike your average 24-hour, 48-hour stomach bug. This can drag on for days to weeks and sometimes gets better and then comes back. This is you. What I want you to know is this is testable. Go poop in a cup. Your doctor can do something called an O&P or a biofire. And it's also treatable. There's an antibiotic called Bactrim or trimethoprim sulfamethoxazole, TMP-SMX, that can be used to treat. Big picture, don't panic. Eat salad, but wash your fruit and veggies, and if your stomach bug is not acting like a normal stomach bug and you have it for days to weeks, get checked and you can get treated. Also, support public health.
So as a doctor mother, these are some of the things that I'm thinking about. And remember, this is not forever. This is just for now until we can find the source of this. Number one, we are only buying fruits that can be peeled, which is a bummer because my kids love berries. For now, we're sticking to things like bananas and oranges, mangoes, watermelons. I'll probably still wash the fruits before I peel them. For veggies, we are sticking with ones that, again, can be peeled, like carrots, or ones that I'm planning on cooking. I've heard it's probably safer to stick with smooth skin vegetables, so like zucchinis and beans, because those are easier to wash versus ones like broccoli. But I think if you're planning on cooking them, it should be okay. Number three, getting some frozen options. We can't get fresh berries, but I'm gonna get frozen ones and make smoothies. Or frozen veggie medleys, because I don't think those have been linked with any outbreaks. And number four, and most importantly, don't defund science.
So let's talk about the explosive diarrhea outbreak, aka cyclosporiasis, and my thoughts on what I may be doing differently as a gastroenterologist who also happens to be in my mid to late third trimester. So the first thing I'm doing is I'm not panicking. I'm not in an area right now with a super high caseload. And even if I was in an area such as Michigan, which obviously has a much denser caseload, it is still relatively uncommon. That's not to say we should ignore it. That's not to say we shouldn't take it seriously, but it is still not something to absolutely panic about. And there are certain things that you may be able to mitigate your risk, but also just being aware of what the symptoms would be, when to get treated, because there fortunately is a treatment for it. I also want to point out that pregnancy does not necessarily affect the course of the disease. It won't result in a more severe course. And it's not linked to any severe fetal outcomes, such as other infections like listeria, hepatitis E, flu, COVID. Those infections scare me a lot more than this one. That being said, I don't want to get it. I don't want to have explosive diarrhea ever, but especially not right now when I'm pregnant. Yeah. So am I making a few adjustments? Yes. And it's based on what cyclosporiasis has been linked to in the past. And that has been primarily importation of foods from endemic areas, and certain foods have been linked previously. And that includes raspberries, cilantro, and a few other things. The raspberries and just berries in general, I am trying to avoid. That's probably the only one food that I'm kind of just being really cautious of, separately from what I was doing in terms of food safety previously. In general, I'm also just recommending avoiding bagged salads. That's something that I wasn't eating a lot of during pregnancy because of the small increased risk for foodborne illnesses in pre-chopped, pre-packaged foods, fresh foods like that. But otherwise, I'm eating my normal diet. I'm eating fresh fruits and vegetables, and I'm just washing them thoroughly. Yes, it's true that washing cannot completely eliminate the risk, but it does mitigate it slightly. So that's just what I'm doing in my day-to-day. Not panicking, making a very few minor food adjustments. What am I doing differently for the patients that I'm seeing? And this is typically someone who's coming to the hospital. We're seeing them as a consult for severe acute diarrhea. Well, similarly, I'm also not panicking because of the area I'm in, and even so, the presentation of very acute onset of diarrhea and other intestinal symptoms is still going to be something more commonly other than cyclosporiasis. And most of the time, an infectious gastroenteritis will resolve over the course of a few days. That being said, if it doesn't, if it's kind of has this protracted course, that would make me want to order a Cyclospora test and treat accordingly. I'm not treating empirically and I'm not panicking because I know most people will get better. I may have a lower threshold for people who are immunocompromised, post-transplant, on immunosuppressing medications to test a little bit earlier, but otherwise, that's my course of action as of right now, and things may change if the cases increase in my area or some other change in the disease that we learn about.
After seeing all of these reactions online, it's easy to understand why Cyclospora has caused so much concern. When people hear words like parasite, outbreak, the first reaction is usually fear, especially when the information is spreading through short videos and personal stories. But it's important to separate awareness from panic. Cyclospora is something people should take seriously, but it is also something officials have experience investigating and managing. I don't believe we should all live in fear of our next meal. It's good enough to understand the risks and make better choices, so stay informed, follow updates from trusted health organizations. Awareness is useful, panic isn't. See you on the next side angle.